Hi everyone, good evening. It's Dr. Jen from drjenmed.com. Welcome to my live today. Today I will be talking about how to know if you may have diabetes. So this is part one in the series. I think I'm going to do this in just two parts. How to know whether or not you may have diabetes. And I hope to go in great length to explain what symptoms you may experience and that you might shrug off and think it's not related. So that's why I'm taking my time to go through this today. All right. So we all know that we hear a lot about diabetes and how it makes people really sick, how it puts you at high risk for heart disease, for cardiovascular disease. What does that even mean? Issues related to your blood vessels, so to your heart, to your brain, to your kidneys. We hear so much bad stories about diabetes. And I believe if we don't do anything about it, this is only going to get worse. So let us start at the very beginning. What is diabetes? So diabetes is a situation in which the sugar in your blood is too high. That's all it is. So in your blood, you have sugar, right? You have glucose. And in diabetes, the blood sugar is too high. That's all it is. So we're not complicated. Good evening, Mrs. Nelson. How you doing? Right? Now, there are different types of diabetes. Your blood sugar might be too high for different reasons. For example, there is a particular hormone called insulin that your body makes to regulate your blood sugar. Everybody know about insulin. You know about that injection some people have to give themselves to keep their blood sugar under control. That is the hormone we're talking about. Insulin. Insulin. And for some people, they do not make enough insulin. And those persons are said to have type 1 diabetes. But you have some people, they make enough insulin, but for whatever reason, the body does not respond very well to that insulin. Okay? And they are said to be insulin resistant, and that is type 2 diabetes. And that is what most people have. Type 2 diabetes. And that's what I'll be talking about today. Now, it's very important to understand this insulin story. Let me just say good evening to Shamila, Cheryl, Carlene. Good evening and welcome. So it's very important to understand this insulin story. Okay? Because long before your blood sugar gets high, you are having a problem with the insulin. You hear what I say? So long before the doctor tell you are diabetic, there is a problem going on with that hormone long before doctor finally diagnose you with diabetes. So let us get back to that hormone now. So there's a gland or organ in your body called the pancreas. And one of the hormones the pancreas makes is called insulin. insulin. Now, you may make enough insulin when you eat some food and your blood sugar is high, right? That hormone insulin is supposed to be secreted, and what that hormone says to the body, it's a signal. A hormone is a signal. It sends a message to the body and says, listen, there's too much sugar in the blood. There is too much sugar in the blood. We need to use it up. Sugar, go into the cells. Go into the cells. You cannot stay in the blood. That is the purpose of insulin. Okay? And what do the cells do with the sugar? The cells are supposed to use this sugar or glucose to make energy in the mitochondria. All right? That is what is supposed to happen. And most of these cells that I'm talking about, they start now to become resistant. Them now listen to what insulin I say no more. So that is when you hear about insulin resistance. And I'm going to touch on the Ozempic them and drugs like that. I'm going to tell you why they work. But I soon reach there. Okay? So the insulin tells the cells, listen, there's too much sugar in the blood and we cannot afford to have high blood sugar because high blood sugar is toxic. What did I say? When the blood sugar is high, it is toxic. It damages your blood vessels, it damages your nerves. You understand? So your body is now trying to get rid of all of this excess sugar and pushes it into the cells. And insulin is the hormone that tells the body to do all of that, let me just say. Understand? But the reason I am breaking this down now is that after a while, every time your blood sugar gets high, the insulin is secreted. Your blood sugar go back down to normal. Why? Because the sugar goes into the cells. But every time you keep doing that over and over and over many years, after a while these cells become resistant. They no want to listen to insulin no more. They are not listening anymore. And that is what is called insulin resistance. And at that point now, your pancreas has to be secreting more and more insulin to try and override the resistance. It's like a man a look a woman and the woman nah listen, so him have to buy, him have to spend more money, him have to show say and drive nice car, him have to tell you, him have to do more and more for sure you say. You have to give him the time of day. That is what insulin does. It has this, in other words, when you are insulin resistant, your insulin becomes high. Please remember that. So insulin resistance, there is high insulin, and that alone causes whole heap of problem. So shout out to the people who suffer from polycystic ovary and tell you about insulin resistance. I'm going to touch on that today. So when all of this hormone problem is going on, so your insulin can be high, but your blood sugar is normal. So when you go to the doctor to check your blood sugar, it is saying you are normal. You are not diabetic. You are not pre-diabetic. Your sugar is normal. But that don't mean that you're having a hormone. That don't mean that you're not having a hormonal problem with insulin. So this can be going on for 10 years. 10 years and more. And your blood sugar is normal. But there will be signs. That is why I'm doing this whole video about the symptoms of this condition. So somebody please write in the chat, your problem is insulin resistance. So you think the problem is high blood sugar. The high blood sugar in diabetes is the result, what am I say, is the result of insulin resistance. Your problem is an insulin problem. You are making too much insulin. Your cells are not responding, and the cells in particular of the liver, of your muscles, and your fat cells, they are not responding to insulin. They say they're not, don't chat to me insulin. So your body has to be making more and more insulin. Then now it reaches a point when it can't manage no more, no matter how much insulin being produced. And the cells cannot take no more sugar going in. It's just too much. Then it now starts to stay in the blood. And when you check it now, the doctor say you are pre-diabetic. You're pre-diabetic. And you still not change nothing. And 2 years pass and then the doctor tell you you are what? Diabetic. That is what happened. 10 years, 20 years of this insulin resistance problem, high insulin levels, hormone problem basically. But it manifests itself as diabetes down the line. It manifests itself as fatty liver. It manifests itself as polycystic ovaries down the line. It manifests itself in all these various conditions. You follow? That is what happens. That is exactly what happens. This was going on for a while. So your next question must be, if you are intelligent, well, doc, why did I become insulin resistant? And I want you to tell me, well, doc, it run in my family. All right, fine, I give you that. It run in your family. Yes, there's a genetic component to diabetes. I'm not going to deny that. Right? But there are other things that cause the cells to become resistant to insulin. You know what? Having too much carbohydrates, the starches and the sweets, too much, too much. Your body have to be producing this hormone to try carry down the blood sugar. So your diet is number one. You're not exercising. You're not burning no sugar. You're not doing no exercise. So it sets you up for this insulin problem. Because if you were burning the sugar, your body would not have to be secreting all of this insulin to get it under control. You're drinking whole heap of alcohol. You're smoking. The toxins in our environment, the pesticide, they are disrupting how the hormones can function. Stress, the high cortisol opposes insulin. Stress. And I'm telling you, until you get to the root of the problem, you will live on pills. You will live on pills. So somebody put in the chat, my problem is insulin resistance. So I'm looking at my list because I want to make sure. Oh, another thing that disrupts this insulin story, lack of sleep. Them the scientific studies and prove all of this for me, I tell you, So the lack of sleep disrupts that insulin secretion. It makes your cells more resistant. So all of the things where Dr. Jen been talking to you about, me no want you go to your doctor and say, Doc, I don't know why I get diabetes. You get diabetes because you name the wrong something them. You not exercise, you're lazy, you're stressed out. You're not sleep properly. You're not eating properly. And maybe running in your family make it worse, you're more vulnerable to it. That is why. Then you're eating all of these chemical foods, all of these processed foods, all of the chemicals them we use and put on our skin, and you know what me I talk about. All of that causes insulin resistance. And when you have insulin resistance, it not sure diabetes tomorrow. It can take 5-10 years. So you see all of you parents and you pick them fat and yam, the whole heap of snacks and juice. You are giving them insulin resistance. You are setting them up. So them now might be a teenager, even a child, right? You are setting them up for diabetes every time you feed them that way. Every time. And I tell you, the insulin resistance manifests in different ways. Insulin resistance can even cause high blood pressure, diabetes, fatty liver. You're damaging your own liver. You follow? The so-called metabolic syndrome, kidney disease, whatever it manifests in various ways. Inflammation in your body, inflammation. So you have all heap of joint pain. You're just inflamed. All from insulin resistance. But the video today is really about how do you know if you might have this insulin resistance? So now you know what causes it. Now how can you tell? Now, me soon tell you the symptoms of diabetes. But me tell you, I did a video, is yesterday or day before, I can't even keep up with days no more, where I tell you, we always get the warnings. We always get warnings and we ignore it to our own peril. You understand? But when you are insulin resistant, true me no want this video go too long, right? You might notice that you get tired easily, especially after you eat. If you notice when you eat, and right after you eat, you feel like sleep. What Jamaican people call that? Righties. When you eat, your need for sleep, you have insulin resistance. What me say? You have insulin resistance. When you eat, you're supposed to feel energized because it is fuel for your body. You're supposed to feel like you can go do some work. You're supposed to have energy. But if when you eat, it is depleting you, what is happening is that you have this insulin resistance. So you want to sleep. So one of the first things you might know, low energy, fatigue, especially after eating. Another common symptom for the itis, well, not for the itis, for insulin resistance, IR, is that you might notice you are thirsty more, just like diabetes. But you are going to tell yourself, say, well, I true, I drink whole heap of water, I want to pee, and whatever. So you're thirsty whole heap, your mouth dry. And you say the time hot, you're dehydrated. Yes, those things can cause thirst too. And then you need to pee whole heap. So you tell yourself you're peeing a lot because you're drinking so much. But you're insulin resistant. You're on your way to diabetes. If you're not already there, you're probably there and don't even know. You wake up in the morning and you take up the phone and you can't see the phone properly. You have blurred vision. Why? The blood sugar high. It causes swelling of the lens of your eyes. And then throughout the day, it clear up. That's how you know you have insulin resistance, pre-diabetes, or diabetes. So these are some of the little symptoms. You notice you're hungry. Or when you eat, you're hungry. You could have eaten 2 patty, 2 cocoa bread, and half hour later, you are hungry. And you just have put on weight. Go so. When you are gaining weight easily, I'm not saying this is the only cause for weight gain. So don't get me wrong. And let's be clear. But people who have insulin resistance, high insulin, they put on weight, them just breathe, inhale the smell of food, and put on the weight. And it is very difficult to take off the weight. So let's say they have a baby and the baby weight now come off. Then put on 10 pounds, then go gym, they go everything, and poor thing, doctor tell you lose weight and it now move. But I'm going to tell you how to fix it. So you put on, you're hungry all the time. Oh, this is my favorite one. Like when you don't eat, you feel like you want to pass out. Your blood sugar goes low, and you feel lightheaded, dizzy. You get hungry. You get hungry plus angry. You're miserable. I've had this symptom. Hungry plus angry, and you can't function till you eat. That is insulin resistance. If you check the sugar normal, that is insulin resistance. May I tell you, so you can have this insulin issue going on for years before it fully declare itself. You follow? So you can be hungry all the time, and you eat, and 2 2s later you eat one mountain plate of rice, and 1 hour later you're hungry. It's like you never eat. And people might look at you and say you're craving and you're greedy. I'm not craving or greedy. You are not. You are not. I'm here to tell somebody you are not. Your body is truly asking for the food because the insulin story is off. You have high insulin. You have insulin resistance. So even though you just eat the wok of food, it is not being utilized in your cells properly. The cell them now respond to insulin, then resistant, then now listen. That is why you are hungry so much. You put on weight, and it is very difficult to take off weight if you don't change certain things. You follow now? Now, as things progress now, you might notice now that when things now, let me leave that for later, when things get really bad. All right? Now, some people might notice some tingling in them feet. Some tingling, and them just say, oh, well, I stand on my foot for, long. I'm a teacher, whatever. I'm a hairdresser, so they just assume it's circulation. But enough of the time, it is your nerves fry, inflamed. Peripheral neuropathy. The sugar too high. The sugar in the blood vessels, damaging the blood vessels, damaging the nerves, etc. You may have a wound a scratch, a cut, and it'll take forever to heal. It's taking forever to heal. Another sign, it's another sign or symptom that you're either diabetic or you're on your way to diabetes. Poor healing wounds. Poor healing wounds. You know what else can happen? Your immune system go haywire. So you find that every minute you're getting an infection, sinus infection, woman, yeast infection, fungal infection, rash everywhere, acne, your skin start break out, diabetes on the way, insulin resistance on the way. But you might notice that you have UTI, urine infection, and often you're having it often. It's like your immune system is weaker. Yes, because when the blood sugars are high, it affects your the cells of your immune system. Try to understand that your blood sugar, when it is high, it affects literally every cell. It's toxic to literally every cell of your body. So as I spoke about on my last live, you get a wound, it turn into sore foot also. It won't heal, you don't have no immune system, etc. When you have the nerve problem, you get a cut, you get a burn. I remember I had a patient, he went to do pedicure, and them scratch, like when the technician, you call them the nail tech, and they rub, scratch the foot, cause them want this foot nice and smooth, right? And the man literally by rubbing got burned and sore up an infection, and him never know till him reach home now and I look on the foot. The mic dead. The audio is not going to be so great. Are you hearing me now? No, it's not Facebook. Maybe my mic. The battery might have died. Are you hearing me now? Still no sound? Wonderful. So, okay, great. So, I don't know at what point you couldn't hear me. So, I'm going to start back from. Did you hear when I said about the immune system? All right. So, as I was saying, it can affect the kidneys, and that is why you pee a lot, because the body is trying to clear out that excess blood sugar. So it makes you pee. And so you end up peeing 3, 4, 5 times a night. It's because it's usually in the night. It happens in the day too, but especially at night. 3, 4, 5 times a night. You're peeing. And then now you go and you get your blood sugar, them stick your finger, and then your sugar is 5.4, and you think it is okay. Oh, I don't have diabetes, I'm good. No, it's not. You are having symptoms of this insulin resistance story. You are on your way to pre-diabetes and diabetes if you change nothing. I had also shared a story, not sure if you could hear, that I said, I remember I had a patient who came with with wounds that had become infected. He went to do a pedicure. And the lady was scrubbing him foot, scrub. You know, they do it to make the foot feel nice and smooth. The heel back especially. And it scrub to the point that it literally burned off the skin. It got infected and had to be dressed, and he's diabetic. But he did not feel any pain. He never feel nothing. It's not till him checking himself now. He realized said the area cut. So these are some of the main symptoms that you might have. But I wanted to make sure you understand that before that blood sugar starts to show high, these are the symptoms that you must look out for. You see on your skin? If you see your skin starting to look dark around your neck, your arm, under your armpit here, the groin, even between your legs, anywhere, it start to look black. It start to feel a little rough, leathery. That it is not dirt and no eczema. That is a sign that your insulin is too high. Are you following? That's the acanthosis nigricans or nigricans. I don't know how you pronounce it. But those are telltale signs. So if you see you putting on weight very easily, you see you're thirsty all the time, you're hungry all the time, you're tired easily, no matter that you sleep. As you eat, you're tired. You know, please know that you are having insulin resistance symptoms. And you're on your way to diabetes if you change nothing. Let me see if there's anything else. Now, okay. So now, apart from, if you know, I want to add this. If you are taking certain medications, especially steroids, prednisone, them something there, please know that it makes you insulin resistant. If you are taking certain drugs for mental health, like for schizophrenia, it puts you at a higher risk for insulin resistance. So how do we normally check for diabetes? You go to your doctor and they send you to the lab, and this is the test I prefer. Let me tell you what they do first. They send you to check your blood glucose, the fasting blood sugar. Fasting blood sugar. Okay? Your fasting blood sugar is the sugar you check before you eat anything. You don't drink or eat nothing from morning. Normal people with normal blood sugar, it does not pass 6. If you are pre-diabetic, it is above 6, but it don't pass 8. So 6 to 8. When you are diabetic, it is above 8. So if you don't eat from morning, you don't drink nothing from morning, and you just do a blood sugar check and you see say it is over 8, that is considered diabetes. Now, let us say you're on the road and you see a nurse doing blood sugar check and you just randomly decide to check your blood sugar. Okay? Normally, it should not pass 8. Normally. Or even if you check it 2 hours after you eat your breakfast or 2 hours after you eat lunch or whichever meal, it should not pass 8. People who are pre-diabetic, their own pass 8, but it not pass 11. So their own is between 8 to 11. People who are diabetic, their sugar goes over 11. Understand? So that is the most common way they check your blood sugar. But I prefer to do the A1C test. Now this test, your doctor now will send you to the lab. And this A1C is a measure of your blood sugar over the last 3 months. Over the last 3 months. So if your A1C is above 5.7, some doctors will use 6, you are pre-diabetic. Some centers use 7.5 to say you are diabetic. No, I'm telling you this. You can starve yourself for 2 days and then check your sugar and it look normal. Right? Because remember that blood sugar check at that time is just telling you what your sugar is at that time. But that A1C will give you an average over the last 3 months. So that is going to really tell me how well you are controlling your blood sugar. But remember, as I keep saying in this video, even if your sugar is normal when you go to doctor, if you are having any of those early symptoms, you need to intervene. Because there's going to come a point that the diabetes will come. The liver is going to get fatty. You're going to develop high blood pressure, high cholesterol, all of those things, the polycystic ovaries, all of that is going to be coming if you do nothing about it. Unfortunately, in Jamaica, we cannot check insulin levels. The labs don't offer it here locally, because that would tell you if you're really on your way. But true, we not have it, we improvise. And I'm telling you this, if you're having those symptoms, you will need to change your whole entire life to prevent diabetes and to reverse it. And yes, I've seen people reverse. I have seen it. I've seen people reverse pre-diabetes and diabetes by changing them whole entire life. Okay? And you must do this before the pancreas reach a point, that gland that made insulin, that it stop or it does not make enough of the hormone. So you need to intervene before things get really bad. Because when things reach really bad, where you're not making enough insulin now, then now you have to go get the injection insulin. So first, your doctor going to put you on drugs like metformin, right? And let me tell you this, the purpose of metformin is to help your cells to become less resistant to insulin. It is to make them more sensitive. But metformin come with a bag of side effects too. Yes, it does. But if you need it, you need it. Every drug has potential side effect, but if you need it, you need it. But what I'm trying to say is this, that the same thing I'm trying to tell you about the insulin resistance, and that metformin work on for try reverse it. You follow? But you can do it with your lifestyle. You can reverse this insulin resistance with your lifestyle. Some of the drugs you take, like the Diamicron, Reclide, and those, they work by stimulating the pancreas to produce even more insulin. I really don't like those class of drugs if I can avoid it. Ozempic and those, they also help your body to become less insulin resistant. But as I tell you, all of these things come with a payback price. It come with a price, not true, which we call side effects. So if you can work on your body naturally, right, which is what I will deal with in my next video. If you can work on it naturally and repair your body naturally, you can literally reverse diabetes, pre-diabetes, insulin resistance, fatty liver. All of these things I tell you about can be done. Okay? I'm going to stop here today. I'm going to do a whole nother video about how to do this on my next live. I've given you enough information. What me want you do is all I want me just say to you. I want you to look in your life. Do I have any of these symptoms? Do I have them? Notice, take a note of how you feel when you eat. Check your urine. Are you urinating a lot? Are you thirsty a lot? Are you hungry? How much weight you put on? Look on your skin. Observe your body. Are you having these symptoms? Keep track of it. Check your weight. Get your blood sugar checked before the next video. Before I do the next video, I want all of you to check your fasting blood sugar and 2 hours after eating and write it down. If you can't even go up to getting the A1C, because I know you would have to go to your doctor to get that done. But at least get your fasting blood sugar and the 2 hours after eating blood sugar. Get those ready for, I'll finish. I didn't plan to come on, but I will come on next week, Sunday, and finish the series. This is part 1 of a 2-part series. I don't want cram everything in one video. I want you to take a survey of everything I've said. Go Google it. Go do some research on insulin resistance. Because let me tell you something. Let me tell you something, really and truly, because you know I'm very straightforward and direct. Let me tell you something. You see, if you take the information that you're going to get over this week and next week and you implement it, it will literally change the total trajectory of your life. Instead of years of sickness, pill, doctor's visits, this test, that test, got your sugar high up, you will literally change your life. If you want, I'm giving you the knowledge, but it is up to you. So your homework for next week Sunday, I'm going to come on a little earlier next week Sunday, because I have a function I'm attending. But your homework is to make a note of if you have any of these symptoms. Observe it. Get your weight done. Get your blood pressure done. Get your fasting blood sugar done. And your 2 hours after you eat, you check the sugar. Those are the things I want. And next week now, we're going to talk about the treatment. We're going to talk about the different treatment approaches, the medication, the supplements, what work, what not work. We're going to go into that next week, Sunday. So this is your information for your knowledge and for you to check yourself. Because sometimes the blood sugar might show up normal and you are having a problem. Okay? Are you getting frequent infections? You find that you're not healing so easily. You're sick every minute. Your immune system low. Check yourself. In fact, maybe during the week, I'll make a list of the symptoms that I want you to check yourself for so you can be ready for Sunday. Are there any questions? Let me take any questions related to what I teach today. Oh, thanks, Gail. What time next week? I will post it because I have to see my schedule for this week. But on next week, Sunday, it will be next week, Sunday, but I'll confirm the time. And God bless you too, Marianne. Okay. I'll give another minute for any questions. You're welcome, Shamela or Sharmela. Any questions about the symptoms? How to know you understand? Awesome. Oh, hi, Ryan. Hey, best chef. Hey, everybody. My chef is on. Hi, Ryan. Best food ever. Best curry goat. Thank you, Lorna. So no question. Okay, so Heather says her fasting is 94. All right, so depending on the machine you have, right? Our units in Jamaica, we use millimoles, right? So 94, we divide that by 18. That would be roughly 5 point something. So that is not bad for fasting. You are most welcome. Yeah, we're going to touch on the GLP-1 next week, Joan, the drugs. Yes, hi, Andrea. Thank you for reminding me. Hello, people. I have started my workout program. Please go and subscribe to my YouTube. It's called Dr. Jen Med. I have exercise workout video on it. I have emotional health topics. Please go give me some love over there. I've given here freely. All you have to do is go YouTube, go click this, subscribe. Do that for me. Let me see that one. Foot bottom. Yes, that needs to be checked, that's for sure. All right, I don't see any questions. Yes, the stress, I explained that already. Sophia, if you go listen back to the video, stress causes insulin resistance by increasing cortisol. Cortisol opposes the effect of insulin, basically. Okay. Okay, Carlene. Oh, Carlene, hi. Hi. And I remember who now. Yes, it can be related to blood sugar, but Marlene, it's not the only reason for blurry eyes, but you ought to check your sugar. Yes. We will talk about the drugs next week. But metformin is notorious for stomach effect, lactic acidosis, etc. All right, so I'm going to come off now because I have a lot of other things to do today. Get ready for work again tomorrow. It was nice seeing you all. I hope this information was helpful. Please do your homework. I'll see you next Sunday. Until next time, this has been Dr. Jen from drjenmed.com. Bye.